Did officials in Florida artificially suppress the COVID daily death toll before the election to help Republicans? Are doctors and officials overcounting the COVID deaths for drama, self-importance, politics, and money? Law-abiding Californians are sick of these shutdowns, by the way. This is the end of hour one of the Jesse Lee Peterson Show. It is Wednesday, December 16th, 2020. Stay tuned for hour two. Jesse Lee will be right back, guys. Hang tight. But first, Hake news, not fake news. COVID ridiculous, the corona scare. Drudge reports. Yeah, I'm back reading Drudge a little. Unexplained gap in deaths appeared in Florida before the election. Shenanigans? Journalists, quote unquote, right, in the South Florida Sun-Sentinel claim that a suspicious pattern suggests that the state may have manipulated a backlog of unrecorded fatalities, presenting more favorable death counts in the days leading up to the 2020 presidential election. At issue is the state's handling of the lag between the date someone dies and the date Florida reports that death in the public count. With minor exceptions, Florida quit including long backlogged deaths in its daily counts on October 24th, 10 days before the November 3rd election, and resumed consistently including them on November 17th, 2 weeks after the election. The result? Daily death numbers seen during the time were significantly lower than they otherwise would have been. Maybe more realistic, though. The change came just 3 days after Governor Ron DeSantis' administration announced they would conduct an additional review of every suspected COVID death, before adding it to Florida's death count. Sounds fair, right? Because MedPage Today writes that, well, we know that Ron DeSantis, the governor, pro-Trump governor, by the way, has suspected that COVID deaths were greatly exaggerated. George Floyd, by the way, is an example of someone who died with COVID, but not of it. But it's not politically useful to blame it on COVID. It's politically useful to blame it on the cop. We know it's as much the OD as his resisting arrest. Perhaps suspicious. How about the other side? What's interesting is there's seemingly not much media scrutiny, at least in the mainstream and the national level, of rumors of motorcycle deaths or other things being counted as COVID deaths. October 27th, Forbes reported that Trump claims doctors are overcounting COVID-19 deaths to make more money, but physicians groups say otherwise. Forbes is very anti-Trump and anti-American. Back in July, ABC 10 of Sacramento did an investigatory fact check to verify, do hospitals get more funding by marking deaths COVID-19 related? Their answer is that yes, hospitals do get funding for COVID-related care, which unfortunately includes deaths. They say that so far it is unverified that hospitals are falsifying records for financial gain. My personal sense is that if there's any faint association with COVID, they'll count that. I have no proof other than that doctors are liberals and selfish human beings, no different from the rest. Also from July, Orlando, Florida's Fox 35 investigated questions raised after a fatal motorcycle crash was listed as a COVID-19 death. CBS 12 said that despite health officials knowing that the man died in a motorcycle crash, it is unclear whether or not his death was removed from the overall count in the state. Orange County, Florida health officer Dr. Paul Pino had told Fox 35 at the time that one could actually argue that it could have been the COVID-19 that caused him to crash. MedPage Today says that the local CBS affiliate followed up on this report, though, and asked the chief medical examiner for Orange and Osceola counties, I don't know how to pronounce it, Joshua Stephanie, medical doctor, about the case. The medical examiner responded that following the motorcycle crash, the person was subsequently hospitalized for a long period of time, got pneumonia, and it happened to be a COVID pneumonia, and they died. In that case, they did attribute it to COVID-19, COVID pneumonia, whatever that means. That man, Jeremy Galloway, was 57 years old. They're not being honest about obesity, by the way, the media. Communist shutdown drama. Drudge reports strict restrictions prompt defiance and anger in California. Rhino outlet Wall Street Journal says they're staying open despite the state ban on outdoor dining, while officials reversed the closure of playgrounds after complaints.